Well, Obamacare is here, and it's being implemented in various degrees across the country. That was the law that was passed a couple of years ago by all Democrats. There were no Republicans voted for it, if you remember, and the rules were changed in the Congress to allow its passage.
Right.
So if you've ever heard of legislation being ramrodded, this was it.
Right.
Obamacare was ramrodded by Nancy Pelosi and the Democrats against the will of 60+% of the American people. But here we are today having to deal with it.
Well, we've got with us perhaps the number one expert in all of America on what's actually in Obamacare. Nancy Pelosi told us we had to pass it in order to find out what's in it. Well, Dr. Betsy McCaughey knows what's in it. She's a constitutional scholar, a patient advocate, former lieutenant governor, the great state of New York. She's written a book with, frankly, what I think is a very hopeful title called Beating Obamacare, Your Handbook for Surviving the New Health Care Law, just published from Regnery in Washington. Dr. McCaughey, welcome to today's Issues.
Well, thank you. I'm so glad that I can talk with you about beating Obamacare, because the fact is so many people are already being clobbered with the unexpected consequences of this law, and they're getting beaten up by Obamacare. And the reason I wrote this book is to give everybody a walkthrough over the next 18 months so you can avoid the landmines and survive this law. There's a good chance it will be defunded if the Republicans regain control of the Senate in 2014, and I believe they will. But in the meantime, there are a lot of things you can do, practical things, to avoid the penalties, to avoid missing out on the care you need in the hospital. And that's really what this book is about. It's a practical guide.
So,
and especially if you're an employer or a business owner.
Tell it. Just jump in, Dr. McCaughey. Give us some tips. I mean, this is this massive bill.
I've got it right here on my desk, all 2,572 pages, and I read it so you don't have to.
Well, thank you.
Right, exactly.
And you put together this book, Beating Obamacare, published by Regnery, to give us some practical help. Well, give us some tips, some things we need to know.
Right. If you're a baby boomer, that means you're in your 50s or early 60s, line up your doctors now, your internist, your cardiologist, because even if you're healthy, by the way, because if you wait until you turn 65 and go on Medicare, you will not be able to find a doctor willing to take you on as a patient. The fact is that over half this law is paid for by cuts to Medicare. So doctors are going to be paid less to take care of seniors than any other kind of patient.
Wow.
If you're going into the hospital, brace yourself, because you're going to get a lot less care than you expect or got in the past. Once again, it's because of the cuts to Medicare. Hospitals will have $247 billion less money to care for patients. So no matter what your age is, if you push that button for help, you're going to wait a lot longer for a nurse. And I'm really advising people, if they can cobble the money together and they're going to the hospital, hire a private duty nurse at least for the first night.
Hire a private duty nurse? You can do that?
Yes, that's right. You can do that, and that means there'll be somebody sitting in your room in case you need help. It's very, very important, because we know that when they spread the nurses thinner and you have to wait longer for help, we see the death rates go up for heart attack patients, for pneumonia patients. They have to wait too long to get help.
We're talking to Dr. Betsy McCaughey.
McCaughey.
Now,
Let me spell it for you.
Yeah, please do, because it doesn't spell like McCoy, does it?
Right. It's the real McCoy.
Yeah.
MCCAUGHEY, Betsy McCaughey. And you can get this book. It's a real simple little book at Amazon.com or at your bookstore. At Amazon, it's only $8, and it'll save you a lot of heartache and money, a lot of fines and penalties. And
do you also have a website?
Yes, BetsyMcCaughey.com. Okay,
MCCAUGHEY.
Dr. McCaughey, what's the truth about the so-called death panels that came up in the election cycle? And there was
I do remember Sarah Palin talking about that.
Yeah.
So let me translate that. There's a provision in this law called Section 3000A, and it awards bonus points to the hospitals that spend the least per senior. Now think about that. I wouldn't take my beloved dog to the vet that spent the least per animal. So why would I take my mother to the hospital that spends the least per senior?
I wouldn't.
I wouldn't,
if I knew
exactly. But the way this law is written, there's a powerful incentive for hospitals to try to be the lowest spending hospital per senior. And it's kind of a spiral down, right, to stay at the bottom. And we have a lot of evidence that shows that the hospitals that are in the bottom fifth in terms of spending per senior, they have substantially higher death rates from heart attacks, pneumonia. In other words, patients who come to those hospitals have a worse chance of getting out and getting home again.
What? There had to be a reason that President Obama, well, I know there is, Democrats and President Obama pushed this so strongly, and in fact, it cost them the House of Representatives.
Right. Well, I think it's ideology.
But But they have to have something. If you don't assign to them all sinister,
right.
plans.
No, I'm saying ideology without being sinister. I'm saying that a lot of those people think that we ought to be like Europe.
Okay.
And this is Europeanizing healthcare.
What's the advantage of that in their eyes?
They just think it's better. They think that we shouldn't get so much health care. If you read the advisors to the president, they've written many articles, and they always talk about how Americans get too much health care and Europeans don't mind waiting in line for their health care, and it's better to sit in an office that's crowded, and Americans expect too many amenities, and what do you need a private hospital room for? That's the kind of thing they write about.
So they think the American medical treatment industry is too profitable, and so they want to scale.
They don't think there should be profit, right? They're against profit. But mostly they think that they could take that money that we're spending on our health care, and they'd like to spend it on other things. They'd like the government to have that money and spend it on other things, like what they call social justice. Okay.
We're talking to Dr. Betsy McCaughey, as she spells her last name, McCaughey. The book is called Beating Obamacare, Your Handbook for Surviving the New Healthcare Law.
Oh, and let me point out, there's another book out there, and the publisher of that book has done something a little weaselly. He's bought a Google ad with my name on it and linked it to his book. So I want to tell you that other book called The Obamacare Survival Guide, that is not the book. Don't get bamboozled.
All right, let's be clear. We're talking about the book Beating
Obamacare, not Surviving Obamacare. Beating it.
Now, Dr. McCaughey, we were told over and over again that if only Obamacare would pass, it would basically largely solve the problem of uninsured people in America. Everybody would have a medical care in some way.
Well, first of all, I certainly believe that every American should have health care. No one should suffer. No one should go without care. No one should lose a home or a lifetime of savings because they get sick and they didn't have insurance. But we can do that. We can help those people without putting the government in charge of everybody's medical care. And that's the part of this law that's so worrisome. Because even if you have a private health plan you paid for out of your own pocket, it says Aetna or Cigna or Blue Cross Blue Shield, the government is still going to be telling your doctor what to do and what not to do.
And when does that start?
In January of 2014, just around the corner.
You think this didn't cost, I know don't look at this from a political standpoint, but this didn't cost President Obama anything. He won. He won re-election.
That's right. And it's very interesting to see that the 2012 presidential election was not a referendum on this health law. It was unpopular. A majority of Americans, every time they're polled, they say they don't want this health law, but they voted for Obama anyway. And I can't tell you why, except to say that most of the pain you're going to feel under this law hadn't gone into effect yet in 2012. They put the candy out there in front. It was kind of a weaselly thing to do. They told women you're going to get free this and free that, free mammograms, free contraceptives. Of course, they're not free. They're They're in your premium, but you don't pay a copay or a deductible when you go to the doctor or to the drugstore. So all of that was intended to attract people, you know. I can't imagine anybody would vote for president based on getting something free, but people do that. And so the 2012 election wasn't a referendum on the Obama health law, but 2014 will be.
I want to you got a bullet point on the back of your book that's kind of shocking that I want you to explain to our listeners. It says the Secretary of Health and Human Services will dictate how your doctor treats you, even if you have a private plan you paid for yourself. Now,
that's right. Section 1311 of the law, which I have sitting right here on my desk, all 2,572 pages of it. Section 1311 says that the Secretary of Health and Human Services can dictate how doctors treat privately insured patients. I mean, for example, telling cardiologists when to use a stent versus a bypass, telling OBGYNs when to use a C-section. There's no specific limit in this law on the amount of dictation and regulations and rules the Secretary can impose in the name of healthcare quality. It can intrude into absolutely every medical decision. This is the first time in history that the federal government has attempted to standardize the practice of medicine. So all doctors do it for all patients the same way.
Now,